This is Dr. Syed Arshad Husain, consultant pulmonologist. I am also adjunct professor in pulmonology at the Gulf Medical University in UAE. I think we can do also on interstitial lung disease antifibrotic treatment. So there are two antifibrotic treatments available. One is called nintedanib and the name here is OFAB. The other drug available is pirfenidone. The name is S-Breed. These are both drugs that prevent stiffening of fibrosis happening in time to come. So they also have a positive role. A lot of time we rely on the steroid tablets and some immunosuppressive agents that would be helpful in this condition. But before we go into the treatment modalities, I think it's important to understand how this is diagnosed. So for a diagnosis, you would need a chest X-ray. The chest X-ray would show some abnormalities and we'd go into high resolution CT scanning of the chest called HRCT chest. We will then need also to do other testing like lung function test. We do some blood testing including autoimmune blood tests. Along with that, we sometimes do exercise testing and to see the 6 minutes walk test to see how much oxygen requirement or how is the oxygenation, because sometimes these patients also benefit from long-term oxygen therapy or oxygen availability at home to keep their oxygen saturation well. They also benefit from pulmonary rehab and a close monitoring by a chest unit or a pulmonologist. The reason we need a close monitoring is that disease could progress very rapidly and people could die if we don't get that monitored closely. So for my patients, I would at least get them scanned once in a year, HRCT chest, to see their progression of the disease if they have severe disease, and also to have at least 4 to 6 months one lung function studies with gas transfers to see how they're progressing. So again, this is a disease which needs a close monitoring and also help from a pulmonologist or a good pulmonology unit to care for these patients. There are other options of newer drugs now being available, but these are usually the drugs that are available for our patients at present. There could be acute exacerbation or chest infection could make things bad, and this sometimes is a cause for the death of these patients when they have severe nasty serious infections. So it is very important that disease is monitored appropriately and properly. I am very happy to take questions regarding that and look after anybody who has these problems of lung fibrosis, interstitial lung disease, or stiffness in the lung as we call it. Thank you.